more popular.
That's right. That's right. Well, if you've ever thought about going to a chiropractor, but you weren't sure if it would really help, my next guest says stop hesitating and make that appointment. Here to explain what chiropractic care can do for you is Dr. Michael Smatt. He is the legislative chairman for the New York Chiropractic Council. Hi, Dr. Smatt.
Hi.
Welcome to Women's Day.
Thank you.
Those
nice
are
to be
nice
here.
hands to make adjustments with. Well, it seems to me that every publication, not every, but a lot of the medical publications and a lot of the magazines and newspapers now are saying chiropractic care is getting more popular than ever, and it's more acceptable than it was in the past because people don't want to take as many medications and cross those medications because there are side effects from those. So they're going to a more natural way of living and being corrected. Is that true?
This is definitely true.
And so when people come in to see you for the first time and they've read about what a chiropractor does, what exactly do you do in the examination?
Well, first of all, most people come to my office by referral. Someone else told them about chiropractic and how chiropractic helped them. And these people have already been through the whole medical route of taking medications and with having minimal or no results. So they heard about chiropractic through a friend. And understanding that the body is a self-healing organism. In fact, the first organ system to form in the body is the brain and the spine, and the purpose of the brain and the spine is to control and coordinate the function of every tissue cell in the body. So we as chiropractors want to examine the patient to see if they have any nerve interference hindering the process of healing.
Do you x-ray them, or what do you do?
Well, based on their history and their examination, we decide if x-rays are necessary, and the misaligned or pinched vertebra are demonstrated on the x-ray with other chiropractic testing procedures.
Now, when somebody gets an adjustment, what does that mean?
Well, the adjustment is the patient is lying face down on the table, and we already at that time located their subluxations. And
which is a pinched nerve.
Which is a pinched nerve,
yes.
Right. And we give them a gentle thrust and reduce and eliminate the subluxation over time.
But by merely touching their spinal cord or their neck or their lower back, you can tell what's out of sync?
Yes, we've been trained to do that.
Mm-hmm. Well, I know you brought a toy with you there, a spine, if you will. Let's take a look at it, because maybe, you know.
By the way, this is a plastic model of the spine. It's not like an unsatisfied patient. But when a bone goes out of place like this, it pinches the nerve, and that's called a subluxation. So the message that the brain wants to give the body is altered. So let's say this pinched nerve is going to the stomach. You now develop stomach problems. Now you have three choices: do nothing about it, or take a pill to mask the symptom, or correct the cause. So we as chiropractors have to decide whether or not the subluxation is the cause of the problem. We don't treat patients' conditions. We don't treat their symptoms. Our job is to correct the subluxation so the body can heal itself.
All right. Now, how many times should a person get adjusted?
Well, that depends on the patient's age, their case history. For example, children with subluxations, they respond very quickly.
So children get chiropractic care?
Oh, yes. We suggest that every child get their spine checked right after the trauma of the birth process, especially if the child experienced a forceps delivery or a suction birth. It's very easy to twist these vertebrae out of alignment, especially in the neck.
Well, I have to admit that a few years ago, I was a passenger in 2 car accidents, and I did get a whiplash. And it hurt for a long time. In fact, anybody that walked by me, I didn't care if I knew them or not, I'd say, could you just kind of rub my neck? And I would do all these neck wells, and I'd lie on a heating pad, and I used that Bengay. Now I use Tiger Balm. But I finally went into a chiropractor and had my neck x-rayed, and it was like this, and most people's neck are like this. So it was pinching on the nerve. So, you know, this is my testimony here on national television. I believe in chiropractors. Of course, you've got to find the doctor you're comfortable with. Does insurance cover the cost?
Yes, most insurance plans cover chiropractic. In fact, in New York, the Insurance Equality Bill was passed effective January of 1998, and it makes it illegal now for an insurance carrier to discriminate against chiropractic care.
Thank you so much for being here and for that information. We appreciate it, Dr. Smatt.
My pleasure. Thank you.
How about an adjustment after we leave, huh? Thanks for watching, everyone. Tomorrow on Women's Day for Miss Guru, Denise Austin. She'll be here with some exercises for pregnant women. Have a great Women's Day.